today we're going to be doing palpations of the hip and pelvis, and we're going to start with the anterior portion. So the first thing we're going to palpate is the pubic symphysis. This is a cartilage joint that's between the left and right pubic bones. It's not routinely palpated by the clinician, but it is important for the patient to palpate it on him or herself because this can be a reference point of pain or inflammation. So what we're going to do is you're going to put your fingers on your navel, and then you're going to just palpate down medially until you find the crest of your pubic bone, and right between that is going to be your pubic symphysis. So if it's hurting, then there might be some inflammation or some problems with the pubic bones there. Okay, the second palpation we're going to do is we're going to find the anterior superior iliac spine, or the ASIS. There's two different ways you can do it. The first one is you're going to put your hands on the patient's hips, thumbs in the back, fingers in the front, and you're just going to palpate with your fingers and find the tips of the pelvis. And they're the most superficial. They stick out really far, and those will be your ASISs. But sometimes you're not going to be able to find them doing that method. So another way is that you're going to palpate the anterior iliac crest. Then you're going to move inferiorly. You're going to pass the iliac tubercles and then turn in, and you'll find the ASIS. Okay, so the third palpation we're going to do is the anterior inferior iliac spine, also called the AIIS. And this one, it's best to palpate with the patient laying supine on the bench or table. And so you're going to have them move their shirt up for you. And first you're going to find the anterior superior iliac spine, or the ASIS. And then what you're going to do is you're going to palpate inferiorly and slightly medial, and that will be the location of your AIIS. It's harder to find when you're palpating it, but it is important because it serves as a muscle attachment. Now we're going to palpate the sartorius muscle. The sartorius originates at the ASIS, and so you're going to find the ASIS first, and then you're going to palpate diagonally, and the insertion is going to be medially and distal to the knee. Okay, so now we're going to find the rectus femoris muscle. You're first going to find the AIIS. So again, you can start at the ASIS, move inferiorly and slightly medially, and so there's the AIIS. Then you're going to find the patella, and you're just going to draw an imaginary line, and that's the rectus femoris, and so you can just palpate down. Now we're going to find the adductor group muscles. It consists of the longus, magnus, and brevis, but when we're palpating them, we're going to palpate them as one big group. But the longus is going to be the most medially, and then the magnus is going to be in the middle, and then the brevis will be after that. And so that's your adductor group.
Okay, so today we're going to palpate for the iliac crest. It should be prominent on both sides, where the trunk begins to curve out. So you'll want to find this curve, and when you palpate along the curve, that'll be the iliac crest. So we're going to find the tensor fascia latae. We're going to start first by finding the ASIS. And then we're going to palpate down the lateral side of the thigh until we get to the distal portion of the knee. So we're going to find the gluteus medius. It's located on the superior lateral buttocks, and we're going to start here on the lateral thigh and palpate superiorly. So we're going to find the iliotibial band, also known as the IT band. First, we need to find the ASIS, at which point we'll be palpating down the TFL, which becomes the IT band as it runs through the lateral portion of the thigh and inserts on the distal portion of the knee. So we're going to find the greater trochanter. We're going to have our patient in a seated position. We're going to have them externally, internally rotate their leg. And we're going to feel here at the lateral portion of the hip for a bony prominence that's moving in and out. Superior to that is the trochanteric bursa, but you won't actually be able to palpate it unless it's inflamed.
Okay, we'll start by palpating for our median sacral crest, which is inferior to our L5, which is about right here. And then we'll find our fused sacral spinous process, which is about right here. Alright, so today we're going to be palpating for the posterior superior iliac spine, or the PSIS. And what we're going to do is we're going to have our patient lying prone. We're going to find our dimples of Venus, which are going to be right here. And just distal to the dimples of Venus, we're going to have our PSIS, which is about right here. Alright, so today we'll be palpating for our gluteus maximus. And the gluteus maximus runs laterally down our thigh and ends halfway of our femur. So it'll be going down and across. Okay, so today we'll be palpating for our ischial tuberosity and our bursa. We'll start off by palpating medially down our buttocks and inferiorly till we find a bony prominence with our palm, and that will be our ischial tuberosity. And just superior of the ischial tuberosity, you'll find the bursa. Now the bursa you won't be able to feel usually unless it's inflamed. Now we'll be palpating for the sciatic nerve. We'll start off by locating the ischial tuberosity. It's about right here. And we'll palpate laterally toward directly in between the ischial tuberosity and the greater trochanter. The greater trochanter will be about right here. So here will be our sciatic nerve. Now we'll be palpating our hamstring muscle group. We'll start off by locating our ischial tuberosity. And we'll palpate posteriorly down our thigh. And it inserts distal to our knee. So about right here. Now we'll be palpating for our piriformis muscle. We'll start off by locating the ischial tuberosity. And just superior to the ischial tuberosity, we'll find our piriformis muscle, which is near the sciatic nerve. Now we'll palpate for our sacroiliac joint. We'll start off by finding our PSIS. This will be right here. And we'll palpate medially and inferiorly near our sacrum, which is right here.